Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Robotic surgery is when your surgeon uses a robotic device to do your procedure, and it's becoming more popular. The percentage of general surgery procedures using robotic surgery increased from 1.8% in 2012 to 17% in 2022. And while 644,000 robotic surgeries were performed in the U.S. in 2021, that number is expected to increase to 1 million by 2028. It's quite a trend, and it's happening here at WVU Medicine as we continue to expand our fleet of robots. What are the benefits of robotic surgery? What kind of procedures can be performed robotically? And are they safe? We'll answer those questions and more as we're talking with Dr. Kristy Ward, Director of Gynecologic Oncology and Chair of the J.W. Ruby Memorial Robotics Committee. Welcome, Dr. Ward, to Live Healthy West Virginia.
Thank you. It's so nice of you to have me. I appreciate it.
Well, we're happy to have you here. So let's just get started with first. I think that we should first start with robotic surgery, is actually robotic assisted surgery. Mm-hmm. Can you just explain a little bit about how robotic surgery works?
Sure. Most people understand a minimally invasive surgery. So it's the surgery where we use the camera and make the small holes in the belly and use instruments to be able to do the surgery rather than doing a very big incision on the stomach or the abdomen or wherever else you want to do the surgery. Robotic surgery is actually robotic assisted minimally invasive surgery. So the robot, the one we're specifically talking about, is either the Da Vinci robot. It assists the surgeon in doing the procedure. And what that means is that the surgeon completely controls the robot. So the robot does absolutely nothing without the surgeon being able to doing it. There are three parts to the robot. There is a patient cart, which is the piece that if you look online has all the arms and looks kind of like a big spider type device. Mm-hmm. That's the part that actually connects to the ports on the patient and where we put the instruments into. Then there is a part called the vision cart that has all of the energy sources for doing things for the surgery, for the gas to blow up the belly, and to have a screen so that the surgeon and the assistants can see it. And then the last part is the console, and that's the part that the surgeon actually puts their head in and puts their hands on to actually control everything that the robot does and all the arms do.
And those arms are much smaller than your hands, right?
So much smaller. So the tips of the instruments that we're talking about are usually less than a centimeter.
Wow.
And the ports that we put in are 8 millimeters. So also less than a centimeter. So yes, much, much smaller. Huh. It also helps stabilize the surgeon's hands to take out any, all of us have just a little bit of movement or tremor.
Sure.
This actually can read that and take that out to even make it a little bit more stable for surgery.
Excellent. So what are the benefits of robotic surgery as opposed to regular open surgery?
So the benefits of robotic surgery are multiple. Minimally invasive surgery over open surgery has a less recovery time, less scarring. It is less painful, and it a lot of times has less operative time, and so less time under anesthesia. The benefits of the robotic surgery is that whenever we do traditional minimally invasive surgery, the instruments are what we call straight stick. So they're kind of straight out like your hands, and they only have this much movement. Okay. The robotics platform has what we call wristed instruments. And so that means whenever the instruments come in, as I'm moving it at the console like this, the instruments actually can move this direction.
Oh, wow.
And so instead of, say, for me, who's a gynecologic oncologist, I do things like lymph node dissections, which are very far on the side of the wall. Whenever I do that straight stick, sometimes it's hard to get over to that direction. Mm-hmm. But with the robot, I can make the arms bend and go exactly where I need them to go and have less hitting and movement. Over both open surgery and minimally invasive surgery, we decrease our length of stay of procedures. So for some large abdominal surgeries, length of stay would be expected to be 3 days. I can do a hysterectomy minimally invasively rather than open and get them out the same day.
Oh, wow.
So less time off work. And open surgery, I ask my patients to be out for 6 weeks, a robotic surgery a week to 2 weeks, depending on how strenuous their job is.
That's a big difference.
It's a huge difference, getting people back to life and back to everything they want to do faster.
So we talked about the benefits, so we have to talk about the risks. What are the risks?
So the risk for robotic surgery are not any greater than the risk of any surgery. So the consent is actually pretty much the same, bleeding, infection, things that can happen during surgery. The big thing that's going to be different is I do have to have a line that anytime I do this surgery, I may have to do an incision on the belly if for some reason I can't complete it robotically. Because sometimes there are things that we need to do that just get a little bit too complex and you actually need to put your eyes and hands in there. But that's really rare. So overall, it's a very, very safe procedure.
Excellent. So why do you think robotic surgery is becoming more popular? I mean, it's becoming more mainstream.
Yes, definitely. So not only we know all the benefits for length of stay, so for a patient perspective, we talked about how that's absolutely wonderful getting them home and back to life. But from a hospital perspective, at WVU and at other places around us, we're always short on beds in the hospital. So things we can do to get people out of the hospital sooner is better so that we can get more critical patients into the hospital. In addition, the cost of the surgery is getting less expensive, and it's really not much more than what we would say is a minimally invasive surgery. It is also better for the surgeon. So laparoscopic surgery, like I told you, is straight stick, so you're kind of doing things straight. It requires kind of a lot of movement and shifting on the surgeon's part. This console is set up to be more ergonomically designed, so there's way less physician fatigue, both eye strain and physical strain, so that we can do more procedures throughout the day and probably have a more longevity in our career. So it benefits not only the patient, but the surgeon and the hospital system.
Yeah, everybody wins, right?
Everybody wins.
So how have we expanded the fleet of robotic devices at WVU Medicine?
So we are now up to 7 devices at JW Ruby. We recently got 2 more of the XI robots.
And what is that? What's an XI robot?
So an XI robot is Da Vinci's robot that has 4 separate arms. So you may use 4 separate port sites to be able to do that. It's kind of the traditional one, like I said, with kind of the spider-looking arms. We also have one SP robot, which stands for single ports, and that all the arms come into one port site, and it's a little bit bigger. The indications for the XI are greater than the indications for the SP. There's only certain procedures that we can do on that, but for the procedures we can do on the SP, it's very, very well suited for that. So we just got 2 more XI robots in May. So now we've taken our fleet from, it was 4 XI and 1 SP to now 6. The robots are mostly in Ruby. There's one that stays over in the Heart and Vascular Institute. And then there's one that we share with the Children's Hospital.
But you're expanding throughout the whole system,
We are
correct?
expanding throughout the
system. Talk a little bit
system.
about where else these robots are turning up.
So in the last couple of years, we only had robots at Ruby and then I think at 2 other hospitals. In the last year and a half, we are up to somewhere between 6 to 7 of our hospitals now have robots. Across the system, we are somewhere between 18 to 20, depending on the area of the contract. I'm not sure what we've actually placed. But that has increased from, I think we were at 11 before. So we've nearly doubled our robotic fleet across the entire system.
And where are they in the system? Is this more like in the southern part of the state or Parkersburg? Or
They're
what
spread
generally?
They're spread all over. There's Jackson Memorial Hospital, Parkersburg, St. Joseph, Uniontown, UHC, and Martinsburg right now.
So the goal, it sounds like, is really to bring robotic surgery closer to home?
Exactly. We get a lot of patients who are sent up here right now to Ruby just for robotic surgery, which is great. We're more than happy to take care of them. But if we can get patients taken care of at home and not have to drive the 2 to 4 hours, it's really good for patient care.
And it seems like patients recover better at home.
Absolutely. That's why we send them out as soon as we can. For hysterectomies, we actually rarely keep people in the hospital because they do much better sleeping in their own bed than they do stuck in a hospital overnight.
Yeah, I think everybody wants to sleep in their own bed as opposed to the hospital
bed.
Exactly. Do you anticipate robotic surgery to become more accessible nationwide? Even?
Absolutely. So robots are expanding across the nation. In addition, it looks like robotic surgery will soon be overtaking potentially open and laparoscopic surgery across the nation. So yes, there are other robots that are being brought into the market in the future. So yes, I think there's going to be an expansion across the nation and some more competition for different systems across the nation.
Excellent. So who's a good candidate for robotic surgery? I mean, is it for everybody?
It's not for everybody. It's a discussion to have with your surgeon. It depends on the type of procedure that you're having. The robotic devices that I'm talking about are specifically for the abdomen and then some head and neck surgeries and then some thoracic surgeries. A lot of the surgeries on the extremities, there's different devices and robots that can be used for that. It doesn't mean they won't be expanding it in the future though.
Yeah.
It is really good for procedures that and people who potentially haven't had a ton of surgery before, like on the area that you're doing.
So not a lot of scar tissue.
Correct. But however, that's not insurmountable. I'll do a lot of patients who have scar tissue. It just really depends on what you can see. But like I said, that might be a patient that gets the incision because you can't get all the scar tissue out. It also depends on the location of what you're trying to get to. So things like the kidney or the uterus or certain things in the lungs may be easy to get to with the robot, or they may not be in a position that we can get to with that angle, and it might be better to do that through open surgery. It also depends on the size of what we're doing. So say if I'm taking out a mass that is 20 centimeters, it doesn't make a lot of sense to do minimally invasive surgery if I have to make the incision to get the mass out. Anyway.
Right. So what kind of procedures can you have done robotically? Because that seems like that's expanding too.
It is. So there are so many procedures. So for me, the procedures that I perform are hysterectomy, removing the ovaries, staging for early ovarian cancer. My partners can do procedures to help pull the bladder up for women who have leakage of their urine. The urologists do prostatectomies, remove kidneys, single port prostatectomy. So with that one special robot is something that our urologists are really working on and kind of pioneering some of the procedures in that. There are some lung masses and some things that can be done in the chest cavity. Our ENT doctors are amazing at pioneering a lot of head and neck tumors and other surgeries. That's also with the SP robot. General surgery and colorectal surgery can do lots of colon surgeries, lots of cancer surgeries. So it is across the board, a lot of us. Oh, and bariatric surgery.
Oh, yeah.
So lots of things that we do. And heart.
Yeah. And it seems like you mentioned, we are pioneering a lot of these procedures. You don't need to leave the state to get this kind of. Talk about that a little bit.
You do not. We have a diversity of highly, highly skilled, amazing surgeons who are doing amazing things with the robots. In addition to those of us that are very proficient and have been doing this. So for me, over 10 years doing robotic surgeries as an attending surgeon, we have surgeons that I have just traveled literally in the last 2 weeks to Parkersburg and to Ripley to train new surgeons, new gynecologists so that they can operate out there. As do our urologists and our ENTs. We all travel across to other WVUs to help proctor and teach other surgeons to do the robot. In addition, we're working to do things that we can do some telehealth and telemedicine with the robot so that we can teach others to do procedures through watching or potentially watch them do procedures.
Yeah.
Like I said, we have cardiothoracic, bariatrics, colorectal, benign gynecology, gynecologic oncology, and then a wide ENT and a wide range of other services who use this.
Because I always like to say it's right here in our front yard, and it sounds like we're putting it in more front yards around the region.
That's the goal.
Yeah, that's great. That's great. So some people want to know, how safe is robotic surgery? Is it any different? Is it better or worse than open surgery, or the same?
It is better than open surgery if you were doing a procedure that is appropriate for the robot. Safety and the type of surgery you have should be discussed with your surgeon. But yes, it is as safe, at least, as minimally invasive surgery and an appropriate candidate as open surgery.
Okay. Can you talk a little bit about the level of expertise among the robotic surgeons throughout the WVU health system?
Absolutely. So like I said, I have 10 years of experience. I'm out of fellowship for 10 years, and that's not including the 9 years of training that I was learning the robot.
Wow.
So almost 20 years experience on the robot. I am almost at 700 procedures on the robot. We have many people who have the same level of experience as me. I know a lot of the urologists, a lot of the ENTs, the cardiothoracic surgeons probably have more experience than I do even, because they've been out a little bit longer. The robot has been out for almost 20 years now.
Wow.
So there's
that
some
went fast.
I know. And then there's a lot of us that have like 4 or 5 years of experience, but that's still, a couple hundred procedures. That's still a lot.
Is that all?
Yeah. And then, like I said, there's several of us that are all learning, but a lot of the people who are learning have been out in practice and have been doing minimally invasive surgery for a long time. And people who have been really well trained to do straight stick minimally invasive surgery pick up the robot really well because they're very used to, it's the same view, it's the same everything. It's actually just a little bit easier once you get used to everything.
Sure.
So while we do, and of course we've got residents that we're training, so we have a wide variety, but I would say the majority of us are pretty highly experienced with the robot. It's not anything new. I know it sounds like it's something new and fancy, but it's been out for a while.
Yeah. So before we go, what's the most important thing you want our viewers and listeners to know about robotic surgery and the expansion of robotic surgery throughout the WVU Medicine system?
So our goal for the WVU Robotics System and Committee is to be the leader in robotic surgery for innovation, research, and patient care in this entire area. And right now we are meeting that goal. We are the strongest robotic service, definitely in West Virginia and the surrounding area, and we are continuing to grow. We want to bring robotic surgery to all of West Virginians so that everyone who is appropriate for this surgery can get this surgery and hopefully closer to home. And if it's something maybe a little more difficult that needs a little more tertiary care, we're happy to take you up at Ruby where we do the more difficult stuff. Mm-hmm. It will get West Virginia back to work and back to play faster. It is good for our health system and good for our physicians, and it is safe, and I'm very excited to make it available to as many patients and physicians as we can.
Excellent. Thank you so much for sharing this information with us, and I think we have a better understanding of how that all works, but thank you so much.
Of course. Thank you for having me again.
No problem. Great. So that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on the Department of Surgery, visit wvumedicine.org/surgery. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or on the all-new West Virginia Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Ward and everyone at WVU Medicine, thanks for joining us.